part of the challenge we have, as I said earlier, is commodities and the challenge with Kemsa, right? And before even I talk about Kemsa, that whole space around drugs, I spoke to one doctor, actually inadvertently yesterday, and he was telling me that they have a long list of drugs they want to register with us, with Kenya. They've registered everywhere else, but Kenya is a difficult nut to crack because there is a cartel of people who don't want anybody else to sell their wares or their drugs in Kenya. They've somehow found the way to lock it up just for drugs from certain suppliers. How serious is that challenge from where you sit? Do you think it is something we need to worry about? Or you think we have enough latitude to have the best drugs and the biggest variety?
You know, one of the reasons why I agreed to attend this session is if you're talking to the person who is going to be at the top. If that is corruption, there's no other way to describe it. Let me tell you, all these systems we're talking about, all these organizations that have been set up, have actually got a very good foundation and very good policies. That's why they were set up in the first place. It is just an issue of how we are managing them, all these vested interests. When there's big money, all those other problems come in. So it has to be that we just committed in terms of, I don't think that there's need to replace those organizations. It's just to revamp them and let them go back to what they were set up for. The other thing which I did not answer, which you mentioned, about the health records system, health management information system. 15 years ago when I was in the UK and I was looking for health management information system for our facility, I went and I've got a friend who works at the NHS and he showed me how their system worked. And I looked and I said, why don't we have something like this? Because in Kenya, what happens, even from one hospital to another, you will go there, and I'm a medical professional, I'll tell you, they'll look at the MRI from this hospital, and he says, this is a radiologist I don't know, so I'd have to do an MRI again. This is the waste we're talking about. We have got a system where we are duplicating the services from Nakuru to Nairobi between one hospital and another. So every time we're duplicating tests, as opposed to going into the system and saying, what tests have you had done? And what's your previous diagnosis? We are diagnosing people sometimes every time they go to a facility, as opposed to having the information. So one thing we need to do, that is something we need. And at that time, my suggestion, I came back to NHIF. There was a system which was being sold, but it was way above what I could afford. I came to NHIF people and told them, you're the only ones who can afford this. And secondly, guess what? You're going to be able to now have visibility into all your providers, all your patients' conditions. So as long as the issue of patient confidentiality can be maintained, that's always the challenge. As long as that confidentiality can be maintained, there are benefits to that system, because even in an emergency, when you receive a patient, you don't have to be going through all the rigmaroles of being able to find out what pre-existing conditions did they have, what were they managed for, I've got a scar in the abdomen, what was the surgery for, and so on. That information will be available. But that is the waste that we're having in our healthcare system, purely because we've not invested in this one big system. So that's one of the greatest ideas that we can be able to implement.
Thank you very much, Dr.
Thank you.
Thank you for your insights.
Thank you very much.
Thank you very much.
Maisha tunaishi Kenya hii yetu jamani, mimi mke wangu hatutatoboa hata kidogo na hii bei ya madawa. Aidha unauza shamba, utauza gari, sio mimi peke yangu. Kila Mkenya kuna hii shida na sijui itakujaisha lini. Hata naona ni heri kabisa niondoke dunia hii, niwache kufundisha watoto wangu, kuwapa taabu. Niende kabisa. Niondoke kabisa.
For us to be able to enrich this conversation, I'll invite Mr. George Gibore for a situational analysis, before we proceed. And then other members, we kindly request you that we stick to the